Fresenius Medical Care has many facilities participating in ESRD Seamless Care Organizations, better known as ESCOs. ESCO represents a new model of healthcare delivery which offers high-quality care that lowers the total cost for Medicare Parts A and B beneficiaries. ESCOs are required to report on 10 quality measures for each patient for ongoing evaluation and eligibility. One of the required quality measures for each ESCO patient is the falls risk assessment, and if necessary, the balance gait assessment. When completing the falls risk assessment in the RN-CIA, if it is determined that within the last 12 months, a patient has had 2 or more falls or has fallen once and sustained an injury, then the balance gait assessment must be performed. Fresenius has chosen the timed up and go, or TUG test, as the assessment tool to be used by registered nurses to identify patients at risk for falls. The TUG test measures in seconds the amount of time it takes an individual to stand up from a standard armchair, walk the distance of 3 meters, or about 10 feet, turn around, walk back to the chair, and sit down. The individual should wear comfortable walking shoes and maintain their normal walking pace without assistance during the exercise. Patients that normally use a walking aid, such as a cane or a walker, should do so during the TUG test. Patients are deemed at risk for falling if they cannot safely accomplish the exercise in less than 13.5 seconds. In preparation for the test, you will need a standard armchair, a measuring tape, and a stopwatch to properly time the patient. Place the chair in a low traffic area, such as a back hallway or a room with adequate space. Let's watch. Good morning, Mr. Jones.
Good morning.
Today I'd like to ask you to take a simple test to help me determine if you're at risk for falling. Would that be okay?
Okay.
Great, thank you. It'll only take a few seconds. Now, when I say go, I'm going to ask you to stand up from the chair and walk to the red line. And turn around, come back to the chair, and sit down. Just maintain your normal walking pace, and I'm going to time you with my stopwatch. Do you normally use any walking aids, such as a cane or a walker?
No.
No? Okay, do you have any questions?
No.
You ready?
Yes.
Set, go. Very good, Mr. Jones. Did you feel lightheaded or dizzy at any time during the exercise? No? All right, great. Thank you again.
Thank you.
Utilizing the TUG test, Mr. Jones does not appear at high risk for falling. He completed the test in less than 13.5 seconds, he did not appear unsteady or unbalanced, and he did not complain of feeling lightheaded or dizzy. After finishing the TUG test, you should document completion in the clinical record, noting the time in seconds and indicating if the patient is at risk or not at risk for falling. If you have a patient who cannot complete the exercise in less than 13.5 seconds, or stumbles, or is unsteady, or complains of lightheadedness or dizziness, you should immediately stop the exercise, assist the patient back to the chair, and document in the clinical record that the patient is at risk for falling. You should also notify the physician and develop the patient's plan of care. Please note, to assure privacy, the test should be conducted in your clinic's designated TUG testing area. Most importantly, anytime you're unsure the patient can safely accomplish the exercise, walk closely behind just in case he or she needs assistance.